Now, measures to stop the spread of COVID-19 in parts of Lancashire have been introduced after a spike in cases in Blackburn. For the next month, people living there must limit the number of visitors to their homes and wear face coverings in all confined public spaces, all in a bid to avoid a lockdown such as the one in Leicester. Our health correspondent, Dominic Hughes, is in Blackburn for us.
Public health officials here in Blackburn have been keeping a very watchful eye on infection rates in the town. They knew they were creeping up. Now they have decided to act. Everyone has seen what happened in Leicester, where those strict lockdown measures were reimposed. Nobody wants to see that scenario play out here.
Blackburn faces a dilemma: how to stop this town from becoming another COVID-19 hotspot.
So it's really important that we understand where the challenge is, and in particular in this instance we know that the challenge is in the community.
In Blackburn, they're trying hard to get the message out to the communities most at risk.
The test results that have come out so far have shown us that of 114 infections, 97 of those were from the South Asian community. So from a data-driven point of view and a factual perspective, it means we've got to act on that information.
The local council is introducing extra measures to try and reverse a rise in infections. They include limiting visits to 2 members from another household, using face coverings in all public spaces, and asking people not to hug or shake hands. In Blackburn, they're using videos on social media to reach potentially isolated communities. But while the town has a significant population with a South Asian background, everyone knows that another lockdown would be a disaster.
We simply can't risk another lockdown in this town, and that's why the measures taken by Blackburn and Darwen Borough Council's public health team are both responsible and also measured.
This isn't a blame game. This is about protecting our families, protecting ourselves and protecting the wider community, and working in collaboration to bring the R rate and the incidence rate down.
It is key that we do reach out to all communities as partners across the borough, and the message is consistent.
This is how one town is trying to contain a rising tide of COVID infections, but it won't be the last.
And meanwhile, in Pendle, which is only about 25 minutes drive away from here, infection rates are also on the rise. Now, the council tells me tonight that that could be down to people in their 20s and 30s who perhaps, in the wake of the lockdown being eased, have become a bit too carefree. They're saying now they need to be careful, and the council will announce what measures it's going to introduce tomorrow.
I'm going to speak to Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School and a former consultant in communicable disease control at Public Health England. And he's also from Leicester. Thank you very much indeed for your time today. When you listen to the measures being introduced in Blackburn, do they sound appropriate?
I welcome it. I welcome it very much, because I get the feeling that the local experts are in touch and are in control of introducing their control measures. What we really need for places like Blackburn or any large city is the timely availability of data, and the timely availability of data not only from testing but also from NHS 111, GP consultations, A&E consultations and hospital admissions. Putting all that together and mapping it at a local area level gives us an early warning of where the problem may be, and then you stamp it out. And I get the feeling Blackburn is doing exactly that.
And in terms of that demand for data, you think that data is being provided in a suitably swift manner?
I hope so. We've had a lot of glitches with respect to Leicester, where the mayor was stunned when he was told, you have a problem. We shouldn't have this. And I get the feeling Blackburn has got it better in that they've got the data and they're acting on it in a faster and in a more pragmatic way, targeting the areas which need to be targeted.
Is there a communications challenge here? Already we have a nuanced message on a national level from the government. Then you have local messaging, which varies from place to place, from Leicester to Blackburn. Is there a risk that people just get confused as to what they're supposed to be doing?
Yes, and I'm so anxious about it. It's very much, we need those firm, succinct, strict, consistent messages across the board. And, you know, the one simple message, the virus has not gone away. You need to be careful. You need to maintain your infection control, still applies, and it applies universally across the country.
I must ask you about one of the big talking points of this week, masks. They're coming to shops in England from Friday of next week. Do you think the government has judged that correctly?
Oh, very much so, but I think it is better late than never. People like myself have been saying since April that masks is one of the other additional armamentums in controlling the spread of infection. And again, with masks, we have got mixed messages. We really need a case of I don't infect you, you don't infect me. Therefore, we should all be wearing masks rather than saying people visiting the shop wear the masks, but the people working in the shop don't have to. That's a mixed, ambiguous, not precise message.
And speaking of messaging, one last question, if I would. In the report we just played, we talked about particular endeavours to communicate with South Asian communities, some of whom are reasonably isolated. Do you think that there are better things that could be done to reach some of these communities?
I think so, and we need local community leaders, the local director of public health, the local recognised and respected faces to take the lead, to be allowed to take the lead and run with this. And when all this is over, I feel we should review the Lansley reforms, where we have lost the strength of public health, both in local authorities and the Public Health England dynamics here. So we need to review how we do these things better going forward.
Lots of important long-term and short-term issues. Thank you very much indeed for sharing your expertise with us. We appreciate it. That's Dr. Bharat Pankhania.